There's no comprehensive studies yet on any of the technologies that you mentioned, the NeoGraft, the FUE2, the Safe Scribe system. All of these different technologies have their advantages and disadvantages. For instance, the NeoGraft uses suction to help the doctor get that graft out of the head. The Safe Scribe has a dull tip instead of a sharp tip. And really, nobody really knows what the best way is to help a doctor take those individual follicular units out of the donor area at the back of your head. There is a couple of things about FUE just in general that I want you to know. The first is that you're going to have to probably shave all or some part of your head in order to get those grafts out, because if you're working on those microscopic levels, you have to be able to see the entire length of the hair, and if your hair is even this long, you won't be able to see the entire thing when you're wearing a pair of loupes or magnifying lenses on your head. The second thing is that you don't get as many grafts as you would with a traditional strip surgery. There's not as much scarring, and the healing is a lot faster, which is why a lot of people are attracted to this technology. But if you're looking to fill in your whole head in a single mega session, this would not be the technology for you. Now, on to FUE. The main differences for FUE and the things that you should know about are, number one, whether it is manual or powered. A lot of the things that you mentioned in your letter to me refer to the powered technique. You can also do it one by hand. But among the different powered techniques, you're going to be deciding between a machine that has suction or no suction. Those who like suction say that it helps the graft to kind of pull out a little bit so that you can get it out more easily. Those who don't like suction think that that might damage the graft, that extra little bit of tension on it. You're also talking about whether the tip is dull or sharp, and this translates directly to damage to the graft. In some hands, somebody would need a dull punch so that they wouldn't necessarily hurt the graft depending on what angle they're using towards the head. And in other hands, people are very comfortable using a sharp punch and don't have high transection rates at all. A transection rate refers to how much hair is damaged in the process of getting it out of your head. And then the last two things I would tell you about would be oscillating versus rotating. When you're using a traditional manual technique, the way this has been done for many, many years, you're using the surgeon's delicate hands to oscillate back and forth. So like this, instead of a full rotation, kind of the way a drill would be. And so that's the main difference is, am I twisting the graft? Is that damaging the graft at all? And then the last thing to consider is how much experience your particular physician has, because that's the one thing that all of us hair surgeons would love to take credit for, but really comes down to your staff, how experienced they are in handling follicular unit extraction grafts. They need to be kept cold, they need to be kept wet at all times, and they are much more delicate than, say, a traditional strip graft. Although those grafts are very delicate as well. So you need an experienced hand, so someone who's not going to provide any crush injury to the graft. And in particular, that is very important with a follicular unit extraction surgery. So what it comes down to for you is, talk to your surgeon, whoever you're considering with these different techniques. Talk with them about whether you would need to shave your whole head for their particular technique. There does seem to be, at least in my research, a predilection for using a dull-tipped instrument, whether it's powered or manual, on the head. That does seem to decrease transection rates versus a sharp-tipped instrument on the body, if you're doing a body hair transplant. The other thing to consider would be oscillating versus rotating. Nobody really knows about whether one or the other is better yet. And then the suction versus no suction. I myself do not use any of the powered suction techniques. I still don't know whether that will damage the graft, and I'd like to see some head-to-head studies before I really kind of jump into that arena. So I use either a sharp or a dull tip, depending on what I'm doing. And I also do a lot of manual. I do it daily, as a matter of fact, on every single patient. We do at least 20 grafts just to test and see if they would be a candidate in the future we do a manual FUE on every single patient. So make sure that you choose somebody who really has experience, who has an experienced staff. Somebody who does hair exclusively is usually a good bet. And also consider how many grafts you would want at a single go. If you're interested in something more incremental, follicular unit extraction is a perfectly reasonable alternative. In a powered setting, somebody who is using something motorized to help them get those grafts out of your head, NeoGraft, SafeGraft, all of those sort of things, you would probably be able to expect between 1,000 and 1,500 grafts per session, depending on whether you shave your head or not. And I would also say that you can get higher than that. In my own hands, I've done 1,890 grafts at a single go. But just doing it manually, that varies too. Several hundred is a good bet for that one. So if you're just looking at something very small, like filling in a tiny little area, maybe a scar or something like that, that would be, you could do a manual technique and that would be perfectly sufficient. If you're still looking to fill in the entire top of your head at a single go with just one surgery and one healing time, then the traditional strip technique would probably serve your needs a little bit better. And then the other thing to think of is scarring. For follicular unit extraction, and this is the main attraction of it, is you will have little tiny punctate, little dot scars that will be very difficult to see. The main way that you can figure out how to see them would be to shave your head. Like you join the Marines, you shave your head, you go to Camp Pendleton, and then you get a tan. Because those little dot scars won't tan, and that'd be pretty much the only way that you can see them, like with a Bic razor. So if you're somebody who never wants a linear scar at the back of your head, follicular unit extraction would really be the only way to go for you to get hair transplant. But you also have to consider that in traditional strip surgery these days, scars can turn out beautifully with an upper and lower trichophytic incision and some subcuticular sutures. I know I'm talking jargon, but if you can, find a surgeon who does that routinely, you will probably have a beautiful, beautiful scar. So for most people, it's really not a big deal. I often tell people if you're making a decision between the two, and you're somebody who likes to wear your hair buzzed short, and you want to maintain that hairstyle, and by buzzed short, I mean below a number 3 on a set of clippers, then you might want to opt for the follicular unit extraction technique. If you are somebody who doesn't anticipate ever shaving their head above, or below a number 3 on a pair of clippers, then a traditional strip surgery would serve your needs just as well. So I prefer, myself, powered follicular unit extraction. I don't typically use suction, which would be the NeoGraft. I use either a dull or a sharp punch, and either an oscillating or a rotating motorized technique, or I can do it by hand just as effectively. I think it just depends typically on the patient. So those different things are currently, in flux. As soon as hair transplant surgeons have the answers, we would, love to optimize this technology for all of our patients. And as soon as we get those head-to-head studies, we'll be able to answer, I think, more of your questions. But in the meantime, find an experienced doctor with an experienced staff, somebody who does hair almost exclusively, and who has a really, kind of crack team behind them, and a lot of experience with follicular unit extraction. And you should do okay with almost any of these techniques.